Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 30 practice questions. Without the way, let's get started.
A school-age child has been diagnosed with strep throat. The parent asks the nurse when the child can return to school. Which is the nurse's best response? 1. 48 hours after the first documented normal temperature. 2. 24 hours after the first dose of antibiotics. 3. 48 hours after the first dose of antibiotics. 4. 24 hours after the first documented normal temperature. The correct answer is 2. 24 hours after the first dose of antibiotics. Children with strep throat are no longer contagious 24 hours after initiation of antibiotic therapy. An antenatal client is informing the nurse of her prenatal signs and symptoms. Which of the following findings would the nurse determine are presumptive signs of pregnancy? Select all that apply. 1. Amenorrhea. 2. Breast tenderness. 3. Quickening. 4. Frequent urination. 5. Uterine growth. The correct answers are 1. Amenorrhea. 2. Breast tenderness. 3. Quickening. And 4. Frequent urination. There are 3 classifications of signs of pregnancy: presumptive, probable, and positive. Signs that are totally subjective or presumptive include amenorrhea, breast tenderness, quickening, and frequent urination. Signs that are objective but not totally absolute are termed probable and include alterations in uterine shape and size and softening of the cervix. Signs that are absolute or positive include hearing the fetal heartbeat, detecting fetal movement by a healthcare provider, and seeing ultrasound images of the fetal outline. When assessing the psychological adjustment of an 8-week gravida, which of the following would the nurse expect to see signs of? 1. Ambivalence. 2. Depression. 3. Anxiety. 4. Ecstasy. The correct answer is 1. Ambivalence. It is common for women to be ambivalent about their pregnancy during the first trimester. Even women who stop taking birth control pills to become pregnant are often startled and ambivalent when they actually get pregnant. This is not pathological. The women usually slowly accept the pregnancy, and by 20 weeks gestation are happy and enthusiastic about the prospect of becoming a mother. The nurse is reviewing discharge instructions with the parents of a child who had a tonsillectomy a few hours ago. The parents tell the nurse that the child is a big eater, and they want to know what foods to give the child for the next 24 hours. What is the nurse's best response? 1. The child's diet should not be restricted at all. 2. The child's diet should be restricted to clear liquids. 3. The child's diet should be restricted to ice cream and cold liquids. 4. The child's diet should be restricted to soft foods. The correct answer is 4. The child's diet should be restricted to soft foods. Soft foods are recommended to limit the child's pain and to decrease the risk for bleeding. You can eliminate answer 1 by knowing there are usually some dietary restrictions following any surgical procedure. The nurse is assessing the laboratory report of a 40-week gestation client. Which of the following values would the nurse expect to find elevated above pre-pregnancy levels? Select all that apply. 1. Glucose. 2. Fibrinogen. 3. Hematocrit. 4. Bilirubin. 5. White blood cells. The correct answers are 2. Fibrinogen and 5. White blood cells. Fibrinogen levels will be elevated slightly in a 40-week pregnant woman because coagulation factors like fibrinogen increase to help prevent excessive blood loss during delivery. A 40-week pregnant woman's white blood cell count will be elevated above normal as a means of protecting her body from infection. How does the nurse interpret the laboratory analysis of a stool sample containing excessive amounts of azoturia and steatorrhea in a child with cystic fibrosis? The values indicate the child is 1. Not compliant with taking her vitamins. 2. Not compliant with taking her enzymes. 3. Eating too many foods high in fat. 4. Eating too many foods high in fiber. The correct answer is 2. Not compliant with taking her enzymes. If the child were not taking enzymes, the result would be a large amount of undigested food, azoturia, and steatorrhea in the stool. Pancreatic ducts in CF clients become clogged with thick mucus that blocks the flow of digestive enzymes from the pancreas to the duodenum. Therefore, clients must take digestive enzymes with all meals and snacks to aid in absorption of nutrients. Often, teens are non-compliant with their medication regimen because they want to be like their peers. A school-age child is admitted to the hospital for a tonsillectomy. During the nurse's post-operative assessment, the child's parent tells the nurse that the child is in pain. Which of the following observations would be of most concern to the nurse? 1. The child's heart rate and blood pressure are elevated. 2. The child complains of having a sore throat. 3. The child is refusing to eat solid foods. 4. The child is swallowing excessively. The correct answer is 4. The child is swallowing excessively. Excessive swallowing is a sign that the child is swallowing blood. This should be considered a medical emergency, and the healthcare provider should be contacted immediately. The child is likely bleeding and will need to return to surgery. When analyzing the need for health teaching of a prenatal multigravida, the nurse should ask which of the following questions. 1. What are the ages of your children? 2. What is your marital status? 3. Do you ever drink alcohol? 4. Do you have any allergies? The correct answer is 3. Do you ever drink alcohol? All of the possible responses are questions that should be asked of a pregnant multigravida, but only one is related to the client's needs for health teaching. A child is complaining of throat pain. Which statement by the mother indicates that she needs more education regarding the care and treatment of her child's pharyngitis? 1. I will have my child gargle with salt water 3 times a day. 2. I will offer my child ice chips several times a day. 3. I will give my child Tylenol every 4 to 6 hours as needed. 4. I will ask the nurse practitioner for some amoxicillin. The correct answer is 4. I will ask the nurse practitioner for some amoxicillin. Pharyngitis is a self-limiting viral illness that does not require antibiotic therapy. Pharyngitis should be treated with rest and comfort measures, including Tylenol, throat sprays, cold liquids, and popsicles. A woman whose prenatal weight was 105 pounds, weighs 109 pounds, at her 12-week visit. Which of the following comments by the nurse is appropriate at this time? 1. We expect you to gain about 1 pound per week, so your weight is a little low at this time. 2. Most women gain no weight during the first trimester, so I would suggest you eat fewer desserts for the next few weeks. 3. You entered the pregnancy well underweight, so we should check your diet to make sure you are getting the nutrients you need. 4. Your weight gain is exactly what we would expect it to be at this time. The correct answer is 4. Your weight gain is exactly what we would expect it to be at this time. For women who enter the pregnancy with a normal weight for height, the expected weight gain is 3 to 5 pounds for the entire first trimester and approximately 0.8 to 1 pound per week from weeks 13 to 40. A child's parent asks the nurse what treatment the child will need for the diagnosis of strep throat. Which is the nurse's best response? 1. Your child will be sent home on bed rest and should recover in a few days without any intervention. 2. Your child will need to have the tonsils removed to prevent future strep infections. 3. Your child will need oral penicillin for 10 days and should feel better in a few days. 4. Your child will need to be admitted to the hospital for 5 days of intravenous antibiotics. The correct answer is 3. Your child will need oral penicillin for 10 days and should feel better in a few days. The child will need a 10-day course of penicillin amoxicillin to treat the strep infection. It is essential that the nurse always tell the family that, although the child will feel better in a few days, the entire course of antibiotics must be completed. Answer 2 can be eliminated because it is a treatment for recurrent tonsillitis, not strep throat. Answer 1 can be eliminated if the test taker understands that bacterial infections need to be treated with antibiotics. Because nausea and vomiting are such common complaints of pregnant women, the nurse provides anticipatory guidance to a 6-week gestation client by telling her to do which of the following? 1. Avoid eating greasy foods. 2. Drink orange juice before rising. 3. Consume 1 teaspoon of nutmeg each morning. 4. Eat 3 large meals plus a bedtime snack. The correct answer is 1. Avoid eating greasy foods. The stomach is extra sensitive during pregnancy, so the pregnant woman should try to avoid foods that will aggravate it even more. Most fatty, greasy, fried, or other generally unhealthy foods are not going to help settle the stomach. These make morning sickness worse. Saltine crackers should be eaten before rising. Drinking orange juice has not been recommended. Although consuming ginger may help to alleviate the nausea and vomiting of pregnancy, neither cinnamon nor nutmeg has been shown to alleviate the symptoms. It is recommended that mothers eat small, frequent meals throughout the day. A school-age child has been diagnosed with nasopharyngitis. The parent is concerned because the child has had little or no appetite for the last 24 hours. Which is the nurse's best response? 1. Do not be concerned. It is common for children to have a decreased appetite during a respiratory illness. 2. Be sure your child is taking an adequate amount of fluids. The appetite should return soon. 3. Try offering the child some favorite foods. Maybe that will improve the appetite. 4. You need to force your child to eat whatever you can. Adequate nutrition is essential. The correct answer is 2. Be sure your child is taking an adequate amount of fluids. The appetite should return soon. It is common for children to have a decreased appetite when they have a respiratory illness. The nurse is appropriately instructing the parent that the child will be fine by taking in an adequate amount of fluid, which will keep the child hydrated. Answer 4 can be eliminated because one should not force the child to eat. If the word encourage had been used, answer 4 would have been a better choice, although still not the best answer. Answer 1 can be eliminated because the nurse did not inform the parent of the importance of maintaining adequate fluid intake. A client enters the prenatal clinic. She states that she missed her period yesterday and used a home pregnancy test this morning. She states that the results were negative, but I still think I am pregnant. Which of the following statements would be appropriate for the nurse to make at this time? 1. Your period is probably just irregular. 2. We could do a blood test to check. 3. Home pregnancy test results are very accurate. 4. You should repeat the test in 1 week. The correct answer is 2. We could do a blood test to check. Because quantitative pregnancy tests measure the exact quantity of human chorionic gonadotropin in the bloodstream, they are more accurate than urine tests that simply measure whether or not the hormone is present in the urine. Similar to the urine tests on the market, qualitative serum tests detect whether or not the hormone is present, but they are still considered to be more accurate than urine tests. A 7-month-old has a low-grade fever, nasal congestion, and a mild cough. What should the nursing care management of this child include? Select all that apply. 1. Maintaining strict bed rest. 2. Avoiding contact with family members. 3. Instilling saline nose drops and bulb suctioning. 4. Keeping the head of the bed flat. 5. Providing humidity and propping the head of the bed up. The correct answers are 3. Instilling saline nose drops and bulb suctioning, and 5. Providing humidity and propping the head of the bed up. Infants are nose breathers and often have increased difficulty when they are congested. Nasal saline drops and gentle suctioning with a bulb syringe are often recommended. Other helpful suggestions for infants with colds are to provide humidity with a cool mist humidifier or take them into a steamy bathroom. In addition, raising the head of the bed helps with drainage of secretions. You can eliminate answer 4 given a basic understanding of interventions to improve respiratory function. Agravida G1 P0000 is having her first prenatal physical examination. Which of the following assessments should the nurse inform the client that she will have that day? Select all that apply. 1. Pap smear. 2. Mammogram. 3. Glucose tolerance test. 4. Biophysical profile. 5. Complete blood count. The correct answers are 1. Pap smear and 5. Complete blood count. At the first prenatal visit, pregnant clients will undergo complete obstetrical and medical physical assessments. The assessments are performed to provide the healthcare practitioner with baseline data regarding the health and well-being of the woman, as well as to inform the healthcare practitioner of any medical problems that the mother has that might affect the pregnancy. A breast examination will be performed by the practitioner to assess for abnormalities, but since mammograms are potentially harm-producing X-rays, they are ordered only in emergent cases. A glucose assessment will likely be performed at the end of the second trimester. A biophysical profile may be done, but not until the third trimester. The parents of a 5-week-old have just been told that their child has cystic fibrosis. The mother had a sister who died of CF when she was 19 years of age. The parents are sad and ask the nurse about their child's projected life expectancy. What is the nurse's best response? 1. The life expectancy for CF patients has improved significantly in recent years. 2. Your child might not follow the same course that the mother's sister did. 3. The healthcare provider will come to speak to you about treatment options. 4. The nurse answers their questions briefly, listens to their concerns, and is available later after they've processed the information. The correct answer is 4. The nurse answers their questions briefly, listens to their concerns, and is available later after they've processed the information. The nurse's best intervention is to listen as the parents express their concerns and fears. The nurse's answers should be brief, knowing that the parents are not able to process information right now. The nurse should be available later if the parents have any other concerns or questions, or if they just need someone with whom to talk. The nurse plans to provide anticipatory guidance to a 10 weeks pregnant client who is being seen in the prenatal clinic. Which of the following information should be a priority for the nurse to provide? 1. Pain management during labor. 2. Methods to relieve backaches. 3. Breastfeeding positions. 4. Characteristics of the newborn. The correct answer is 2. Methods to relieve backaches. This 10-week pregnant client will be entering the second trimester in a couple of weeks. As the uterine body grows, the client is likely to experience backaches. It is appropriate for the nurse to provide information about this possibility and ways to relieve them. The parent of a child with cystic fibrosis asks the nurse what will be done to relieve the child's constipation. Which is the nurse's best response? 1. Your child likely has an obstruction and will require surgery. 2. Your child will likely be given IV fluids. 3. Your child will likely be given Miralax. 4. Your child will be placed on a clear liquid diet. The correct answer is 3. Your child will likely be given Miralax. CF clients with constipation commonly receive a stool softener or an osmotic solution, such as Miralax orally, to relieve their constipation. Answers 1 and 2 can be eliminated because surgery and IV fluids are not indicated for constipation. A client asks the nurse what was meant when the physician told her she had a positive Chadwick sign. Which of the following information about the finding would be appropriate for the nurse to convey at this time? 1. It is a purplish stretch mark on your abdomen. 2. It means that you are having heart palpitations. 3. It is a bluish coloration of your cervix and vagina. 4. It means the doctor heard abnormal sounds when you breathed in. The correct answer is 3. It is a bluish coloration of your cervix and vagina. Chadwick sign is a probable sign of pregnancy. The bluish coloration is a result of the increase in vascularization of the area in response to the high levels of circulating estrogen in the pregnant woman's system. A 2-year-old has just been diagnosed with cystic fibrosis. The parents ask the nurse what early respiratory symptoms they should expect to see in their child. Which is the nurse's best response? 1. You can expect your child to develop a barrel-shaped chest. 2. You can expect your child to develop a chronic productive cough. 3. You can expect your child to develop bronchiectasis. 4. You can expect your child to develop wheezing respirations. The correct answer is 4. You can expect your child to develop wheezing respirations. Wheezing respirations and a dry, non-productive cough are common early symptoms in CF. Answer 2 can be eliminated because of the word chronic. Chronic implies that the disease process is advanced rather than in the initial stages. Answers 1 and 3 can be eliminated if you know of the signs and symptoms of advanced lung disease. A client enters the prenatal clinic. She states that she believes she is pregnant. Which of the following hormone elevations will indicate a high probability that the client is pregnant? 1. Chorionic gonadotropin. 2. Oxytocin. 3. Prolactin. 4. Luteinizing hormone. The correct answer is 1. Chorionic gonadotropin. Human chorionic gonadotropin is produced by the fertilized egg. Its presence in the bloodstream signals the body to keep the corpus luteum alive. Until the placenta takes over the function of producing progesterone and estrogen, the corpus luteum produces the hormones that are essential to the maintenance of the pregnancy. Oxytocin is the hormone of labor. It is not measured as a sign of pregnancy. Prolactin is the hormone that stimulates lactogenesis immediately after delivery. It is not measured as a sign of pregnancy. Luteinizing hormone is the hormone that stimulates ovulation. It is not measured as a sign of pregnancy. The parent of a child with cystic fibrosis is excited about the possibility of the child receiving a double lung transplant. What should the parent understand? 1. The transplant will cure the child of CF and allow the child to lead a long and healthy life. 2. The transplant will not cure the child of CF, but will allow the child to have a longer life. 3. The transplant will help to reverse the multisystem damage that has been caused by CF. 4. The transplant will be the child's only chance at surviving long enough to graduate from college. The correct answer is 2. The transplant will not cure the child of CF, but will allow the child to have a longer life. If the child were not taking enzymes, the result would be a large amount of undigested food, azoturia, and steatorrhea in the stool. Pancreatic ducts in CF clients become clogged with thick mucus that blocks the flow of digestive enzymes from the pancreas to the duodenum. Therefore, clients must take digestive enzymes with all meals and snacks to aid in absorption of nutrients. Often, teens are non-compliant with their medication regimen because they want to be like their peers. A 16-year-old G1P0000 is being seen at her 10-week gestation visit. She tells the nurse that she felt the baby move that morning. Which of the following responses by the nurse is appropriate? 1. That is very exciting. The baby must be very healthy. 2. Would you please describe what you felt for me? 3. That is impossible. The baby is not big enough yet. 4. Would you please let me see if I can feel the baby? The correct answer is 2. Would you please describe what you felt for me? Quickening, or subjective fetal movement, occurs between 16 and 20 weeks gestation. At 10 weeks gestation, it would be impossible for the young woman to feel fetal movement. The nurse, therefore, should elicit more information from the teen to determine what she had felt. The parent of an infant with cystic fibrosis asks the nurse how to meet the child's increased nutritional needs. Which is the nurse's best suggestion? 1. You may need to increase the number of fresh fruits and vegetables you give your infant. 2. You may need to advance your infant's diet to whole cow's milk because it is higher in fat than formula. 3. You may need to change your infant to a higher calorie formula. 4. You may need to increase your infant's carbohydrate intake. The correct answer is 3. You may need to change your infant to a higher calorie formula. Often, infants with CF need to have a higher calorie formula to meet their nutritional needs. Infants may also be placed on hydrolysate formulas that contain medium-chain triglycerides. A 20-year-old client states that the at-home pregnancy test that she took this morning was positive. Which of the following comments by the nurse is appropriate at this time? 1. Congratulations, you and your family must be so happy. 2. Have you told the baby's father yet? 3. How do you feel about the results? 4. Please tell me when your last menstrual period was. The correct answer is 3. How do you feel about the results? Some pregnant women are happy about their pregnancy, some are sad, and still others are frightened. At the initial interview, it is essential that the nurse not assume that the woman will respond in any particular way. The nurse must ask open-ended questions to elicit the woman's feelings about the pregnancy. The parent of a 4-month-old with cystic fibrosis asks the nurse what time to begin the child's first chest physiotherapy each day. Which is the nurse's best response? 1. 30 minutes before feeding the child breakfast. 2. After deep suctioning the child each morning. 3. 30 minutes after feeding the child breakfast. 4. Only when the child has congestion or coughing. The correct answer is 1. 30 minutes before feeding the child breakfast. CPT should be done in the morning prior to feeding to avoid the risk of the child vomiting. A client is in the 10th week of her pregnancy. Which of the following symptoms would the nurse expect the client to exhibit? Select all that apply. 1. Backache. 2. Urinary frequency. 3. Dyspnea on exertion. 4. Fatigue. 5. Diarrhea. The correct answers are 2. Urinary frequency, and 4. Fatigue. During the first trimester, the body undergoes a number of important changes. The embryo is developing, the hormones of the body are increasing, and the maternal blood supply is increasing. To accomplish each of the tasks, the body uses energy. The mother is fatigued not only because the body is undergoing great change, but also because the thyroid gland has not caught up with the increasing energy demands. In addition, because the organs are confined within the bony pelvis, the enlarging uterus prevents the bladder from expanding with large quantities of urine. As a result, the woman needs to urinate much more frequently than she did prior to becoming pregnant. Which would the nurse explain to parents about the inheritance of cystic fibrosis? 1. CF is an autosomal dominant trait passed on from the child's mother. 2. CF is an autosomal dominant trait passed on from the child's father. 3. The child of parents who are both carriers of the gene for CF has a 50% chance of acquiring CF. 4. The child of a mother who has CF and a father who is a carrier of the gene for CF has a 50% chance of acquiring CF. The correct answer is 4. The child of a mother who has CF and a father who is a carrier of the gene for CF has a 50% chance of acquiring CF. If the child is born to a parent with CF and the other parent is a carrier, the child has a 50% chance of acquiring the disease and a 50% chance of being a carrier of the disease. The midwife has just palpated the fundal height at the location noted on the picture below. It is likely that the client is how many weeks pregnant? 1. 12 weeks. 2. 20 weeks. 3. 28 weeks. 4. 36 weeks. The correct answer is 1. 12 weeks. The client is likely 12 weeks pregnant. At 12 weeks, the fundal height is at the top of the symphysis. The fundal height is assessed at every prenatal visit. It is an easy, non-invasive means of assessing fetal growth. The nurse should know that the top of the fundus is at the level of the symphysis at the end of the first trimester.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.